a chiropractor and a certified ergonomist with the Nova Wellness Center. And we'll be talking to her. She'll be telling us about a number of things, how we live our lives to stay completely well. Holistic wellness. By Dr. Asheley Ashietey. And as I did indicate earlier on, she is a chiropractor and also a certified ergonomist. Dr. Ashietey, a big welcome to you. Thank you for joining us on the Asaase Breakfast Show.
Thanks for having me.
Okay, if you could please get closer to the mic too, we can hear you better. Beautiful, beautiful, great. So today we are talking about wellness. We're talking about wellness in general, but today we want to be talking about one issue, what we call the text neck. The text neck. And that is what we are talking about today. And we'd want to find out what the text neck is. I mean, where does it come from? What is informing that? Since when did that become a condition that we need to even pay attention to? And how does it manifest? What are some of the symptoms? What causes it as well? And how we can generally deal with it? So maybe starting from the basics. Text neck. What is it?
Text neck is a term that has been coined, especially now because all of us are on our phones and our gadgets and we're constantly looking down. So text neck is the physical stress or the repetitive injury that our cervical spines or the neck experience or go through due to what we call that downward and forward posture of the head over a long period of time. And as a result, you would experience things like neck pain, shoulder pain, headaches, upper back pain, sometimes even numbness in the hands or even your face if care is not taken. So text neck is that broad term that describes all these symptoms that can come on due to that poor posture of the head when we're using our phones extensively.
So this pain, has it got to do with the bones or it's got to do with the muscles within the region that you talk about?
So both.
Okay.
Both. I don't have my spine here. I forgot to bring it. But
okay.
If you look at the spine, you realize that it has some curvatures in it.
That's correct.
That's how the spine was made. But when we do this for so long in the neck, the curve in your cervical spine starts to straighten. So as it straightens, then there's more pressure on the muscles, on the ligaments. The nerves are not able to go out freely. And over time, that is what causes the muscular tension, the stiffness in the neck joints. And if left unresolved, it can lead to what we call cervical radiculopathy, which is the numbness and tingling, the pins and needles sensation that you get in your hands.
Cervical radiculopathy.
Yes.
Brofo. Cervical radiculopathy.
Yes, correct.
I just want to be sure that I'm getting it right. So, looking at, we know that the spine, it's a long extension. Text neck, which region of the spine does it affect?
So main region would be the neck or the uppermost part of the spine and the upper back. So your cervical spine and then the upper thoracic spine is what would be affected. If you take notice, these days you see a lot of people and their posture is like that. So the head is jutting forward, the shoulders are rounded, the upper back, there's like a hump. And we are attributing a lot of this to that prolonged use of our tablets, cell phones, our laptops, because a lot of us are stuck on these gadgets all day long.
So when you say the upper thoracic part, you are talking about above the heart area?
Yes. So thoracic spine is from the upper back to the mid-back portion.
Okay. So the upper part of it.
Yes.
Okay. You have already indicated that it's as a result of the use of some of these devices, these gadgets, phones, tablets, and all of that. But these are devices that we cannot stop using. So what aspect of the use of these devices, or which way of the use of these devices causes this particular condition, the text neck?
Yes, so it's like a necessary evil. We can't do without these. So what we are advising is using them well or properly so that you don't injure yourself. So we want to look at how you can maintain better posture, for instance, whilst using the phones, how we can minimize the amount of time or the screen time we have, things that we can do to negate or reverse that poor posture whilst we're using these gadgets.
And in terms of the manifestations of the text neck, I mean, you've indicated there will be some stiffness of joints and all of that, but in terms of the person who is suffering it, how does the person generally feel to be able to say that I am experiencing a text neck?
Okay, good question, Benji. So one of the most common signs will be pain. Pain. So it could start with neck pain. It could be upper back or shoulder pain. Headaches are also common because your neck muscles attach directly to the skull. So when your neck muscles become tight, it affects how blood flow, nerve flow gets to your head region. So headaches become common. Eye strain as well, because you see when you are constantly looking down and your eyes are so close to these gadgets, the gadgets also radiate a certain form of light into your eyes. So over a long period of time, eye strain can also become a problem. So any of these symptoms, shoulder pain, the numbness, or even difficulty moving, you realize that you are not able to have what we call full range of motion because you are not able to look up at the ceiling freely, and it's like something is stopping you, or you can't even look down at your toes. Maybe you can turn to the left more, but you cannot turn to the right. So decrease in the range of motion is also something that could be a sign that there's a problem in the cervical spine.
So pain, and the pain is not just in the neck region, but also headaches.
Yes.
And you are also talking about the eye strain as another symptom, and then a limitation in the full motion of your head, your neck. So these are the three main manifestations.
Three main things. And then sometimes to posture. That's another one, a big one. You'd realize that all of a sudden maybe your neck or your head seems like it's shifted one way or the other, or you realize that it's stuck. You just can't move it. So posture, abnormal posture in the head and neck region could also be another sign.
About posture, maybe not specifically the text neck, but I want to know if it is connected in any way. There are conditions like lordosis, scoliosis, sclerosis. All right, all this is all right. Are they in any way, extensions of the text neck, or is this something that can be caused from the text neck, for instance?
So they can all be interconnected.
And maybe you can give us a bit more education. I just mentioned them like that. You can let us know what they are.
Okay.
Yes.
Sure. So they can be interconnected.
Yeah.
Scoliosis, for instance, is a spinal condition where either the whole or a portion of the spine is curved towards the left or the right side.
Okay.
So instead of having a straight spine, you realize that it's bent. And it could be just the thoracic, it could be just the lumbar, it could be just the cervical, or sometimes all three in what we call an S curve.
Okay.
So it has multiple curves.
So that is scoliosis.
That is the scoliosis.
So the S curve, scoliosis.
Exactly.
S for,
Exactly. So most people who have scoliosis will also have a text neck presentation, just because the spine is trying to balance, the abnormal curvature. So when we look at X-rays, you realize that a lot of people who have scoliosis will have what we call a straightened lordosis, which you also mentioned. So that's what I'm saying. They can be interconnected. And then you also mentioned
the lordosis.
Lordosis is simply the curvatures of the spine.
Okay.
So the cervical lordosis is the natural neck curve. Like I mentioned, if you look at the spine from the side, you would see these curvatures. So the neck curve is what we call the lordosis.
Okay.
And then we also have what we call kyphosis.
Okay.
Kyphosis has got to do with the thoracic spine. And that is a hyperkyphosis is when you see people and they have a hump on the back. That is what we call hyperkyphosis.
They have a permanent booger status.
You could say that.
Okay.
Yes.
So that's hyperkyphosis.
Kyphosis,
Okay.
yes.
So these are some of, and they are connected to.
Very, very much so.
Are they the causing or they are the resultant effect of a text neck?
So, for instance, if you have hyperkyphosis, if not controlled, naturally your head is also going to jut forward, just because the body is one, and whatever is happening in one area is ultimately going to affect the other. So they can come hand in hand, especially if left untreated.
That's concerning. And so now let's talk about solutions. I mean, I think we've painted the picture as grim as it could get. How do we ensure that, one, we prevent it, and two, should it occur, how can we correct it?
So the prevention, excuse me, are some of the things we've talked about: the screen time, the posture. But if you are already experiencing these symptoms and you know you're guilty of text neck, you know you're on your phone 3-4 hours at a time, then you need to, first of all, have an evaluation done, because we need to see what is causing the pain. Is it just the text neck from the spinal problems, or could it be other things? Is it congenital, like were you born with it, or is it something that has developed? So an evaluation can be done. And when it comes to what we call musculoskeletal problems, things like neck pain, headache, shoulder pain, all the research is showing that conservative treatment is the way to go.
Okay, so when you say musculoskeletal, it's muscle and skeleton.
Exactly.
Okay, all right.
Exactly. So that's your body pain, your headache, your shoulder pain, your back pain, knee pain, all those are musculoskeletal issues.
Okay.
So where the research is showing that using conservative treatment, that is chiropractic care, we have physiotherapy, we have massage therapy, there's acupuncture, all these fall under what we call alternative care, is more effective in treating these conditions than just, relying on painkillers to kind of soothe the pain. So as far as treatment, we at Nova Wellness Center, we use chiropractic adjustments. We do spinal decompression. We also have a spa that uses massage and a wide range of services, which are all natural and conservative. No medication at all, no surgical procedures, but we're very effective in helping people treat these conditions.
So 3 main solution points coming from Nova Wellness Center: the chiropractic service, the spinal decompression, and then the spa service.
Yes.
I'm sure the spa service, a lot of people will know what a spa service is, and chiropractic, we know you adjust our bones and all.
Yes.
But what is spinal decompression?
Spinal decompression, now we're using technology. So the chiropractic care, chiro means hand. So chiropractic, traditional chiro, I would use my hands to physically look at the spine, feel it, see where the bones are out, and then I would adjust it or perform a chiropractic adjustment, as we call it.
Yeah.
But now there's technology, which is even, it's faster, it's more effective. So that's the spinal decompression machine, which we're able to work on the disc. So we have some disc in between the spinal vertebrae, and we're able to use the spinal decompression machine to open up those disc spaces so that we can reduce pressure on the nerve. So now, instead of using my hands to do the adjustment, we're able to use this equipment to help the spine get into a better shape as well.
So the decompression is to reduce the pressure within the spine.
Correct.
Interesting. Then you are offering some real solutions to a lot of people there. Maybe, yes. So for those of you who are watching on Facebook, you can see some of these solutions being projected on Facebook. So, just follow the conversation, and there's a lot more in terms of the services that are provided by Nova Wellness Center when it comes to the issue of text neck. Any final words around the issue of text neck? And especially, let me ask this one before you give your final words. Especially when you are in a relaxed posture, is it better for you to lie on your back to use a device, or you are better off sitting and then looking, from a seated position?
So what I always tell people is, imagine that whatever you're doing, whether you are seated or you're laying down or you're standing, just imagine keeping your spine upright. So as I'm sitting now, I'm trying my best to keep my spine upright. The minute I do this, I lean back, my spine is no longer upright. If I veer my body this way, I'm no longer upright. If I do this, I'm no longer upright. So the trick is, imagine that there's something pulling your spine from the top of your head to keep you all the way up. So once you have that in mind, then whether you're seated or you're standing, whether you're using your computer or using your phone, then you're able to hold up that posture. Yes.
So you should be centered, in essence.
You should be centered, and your spine, imagine you can see your spine in your back. We never see it, and that's why we don't pay attention to it. But imagine it's there. You want to make sure that it's centered and it's upright, not bent forward or backwards or left or right.
You just got me readjusting myself in my seat. But yes, so let's take final words on text neck. How we are to deal with it moving forward, maybe a summary. Maybe we are to change our pillows or something, if that is also a possible causing agent of our text neck. Just wrap it up on this first episode.
So I'm going to give you 3 pointers. So if people didn't get anything from all our blab this morning, at least
they can catch this one.
They should catch this last 3. So number 1, first trick, raise your phone up. Okay, and most people say it's uncomfortable. I see my brother's picking the points already.
So Kyphosis just adjusted himself.
Yes, I love it. Good. So next time I come, I'm going to check you out and make sure you haven't forgotten.
Okay.
So you want to make sure that the phone is up.
Okay.
Make sure the topmost part of the phone is about your eye level.
Okay.
That's the trick. And hold it up there. And because you are not used to it, it may feel a bit weird when you start.
Yeah.
But it's like any habit. You just have to continue doing it, and it will get stuck. So raise your gadgets up to eye level, guys, and that would avoid you from looking down, bending your head down. That's number 1. Number 2, you want to reduce the screen time. So I know people who can be on their phones like this all day long or hours. So you want to make sure that at least 45 minutes to 1 hour, you take a break from the screen. Not only is it good for your spine, it's good for your eyes, it's good for your brain, because these radiation that come from the phones also affect your brain. So you want to reduce screen time, and not just the phones, the tablets, the laptops, anything that has a screen, you want to reduce it. So when you take a 5-minute break, you can walk around, and you realize that when you're walking, obviously, naturally, your posture is better. When you're stretching, you're going to have better posture. So you can take a break and walk, do some stretches here and there. And then also reverse posture exercises is what I call them. And they're very simple. Those watching us on Facebook, you're stuck like this. So reverse the posture. It's as simple as that. Stretch to the left, to the right, look up, look down, rotate it. Simple things like that. It will help with your circulation. It will help you focus better, and it will help reduce the pain as well. So these will be my 3 D's, things to do to reduce text neck.
Okay, and maybe a last one. For those of you who use laptops, get a laptop stand.
Yes.
that helps you adjust the screen to your eye level, so you don't have to bend your neck.
Thank you.
Yes, and on that note, we'd want to thank you very much, Dr. Asheley Ashietey. She's a chiropractor and a certified ergonomist, and she's with the Nova Wellness Center. And the Nova Wellness Center is the sponsor of the Health Post on the Asaase Breakfast Show.